There was an added burden somewhat to my role, other than seeing my father be in the hospital, a burden that I don't wish on anyone. My father, after some consideration, had elected to choose me as being the one on his healthcare directive, to be responsible that if my father his life needed to be sustained in with any artificial means. My father wanted it clear that it was his choice to not have his life sustained in any artificial way. And when we checked into the hospital, I thought I was being efficient in providing them with the signed healthcare directive, that they understood from day one that if that choice had to be made, that I would be the one that would be taking that responsibility. And I recall, in fact, saying to my grown children that never in my life had I ever interviewed to be God and to be in the position of acting as God. And I remember having this conversation that I initiated with the doctors and made it very clear to the doctors that I wanted them to be straight with me and I wanted to know. And something that I didn't know about, which I'd never had an experience with, was that the doctors were perpetuating what I later called the conspiracy of hope. They weren't being honest with me. They weren't telling me that it's clear that because your father's health has now changed pretty rapidly and declined, that there really is very little hope that he's ever going to be able to walk out of this hospital. And so, unfortunately, we spent days and hours agonizing, believing that there was still hope. And that was actually when Carolyn showed up and really was able to burst through this kind of hypnosis that had kind of overcome all of us, where we wanted to believe that the doctors were still holding out hope, so we should just continue to sit there hour after hour waiting, even though my dad then was in ICU, wanting to believe that the doctors aren't giving up on him, so we shouldn't give up on him, and we shouldn't take any affirmative action that would end his life at this point. And it was Carolyn showing up that I think changed it.
I got there after Mikol told me that his father had deteriorated to the point that he was on a respirator. And I could understand why they made the choice, because he was conscious, he was having trouble breathing. I thought that was a reasonable course of action. But I was there when he went through the healthcare directive and made sure that I understood, this is, a couple of years prior, what he really wanted. He really didn't want a code, that is to be resuscitated. He really didn't want to have his life sustained by artificial means. When the doctors would come in and say things like, well, we haven't given up hope, it's the 4th of July weekend, we're just going to go away for 4 days and we'll see how he's doing when we get back. It was at that point that I became angry, because I knew they weren't being honest about the fact that he wasn't going to keep surviving unless they kept putting things in his body to prop him up. It was clear to me, just as a nurse from a very basic vantage point, and it's been a long time since I've actively practiced nursing, but from a basic vantage point, I could see that he was failing. There was no turning back. Even if they were able to change some of the system-wide failures that were going on in his body, what the outcome would have been of that, if they kept him alive, wasn't going to be good.
So you got angry.
I was angry inside. I was angry at their dishonesty with themselves. Doctors are trained to save lives and to heal. I really understand that. But they're not very skilled at honoring someone's wish to let go of life-sustaining measures.
So how did your anger manifest itself in this situation?
I had to hold back. I had to not say anything in front of the family members who were most affected by this. I spoke with the nurses, and I said, in ICU, I said, I don't know if I have this wrong. It's been a long time since I've worked in a hospital, but it looks to me as if Joe is dying. Is that what's going on here, or do I have this wrong? And they nodded their assent, as if to say, of course, he's not getting better. Of course, the end of his life is coming. And I couldn't understand why no one was being straightforward. But it was clear when I walked into the ICU and I saw no fewer than 8 IV lines in this poor man, that artificial means were indeed being employed. And I waited until after a little time had passed and Mikol had digested, shall we say, some of the reality by looking at his father, that I took him aside individually and I said, look, your dad put this job on you, that you are the one, the agent on the health care directive. That means you're supposed to honor his wishes. By this time, of course, his father was sedated enough to be in a coma-like state. He couldn't speak for himself. I said, you have to speak for him, because if you don't speak for him, they could go on like this perhaps for weeks. And he cried and he thought about it and he struggled with this idea of playing God, and it was very painful, it was very emotional, and he slept on it. And he woke up the next morning and he said, you know, you're right. We have to stop them. That's what Dad wanted. They were about to poke and prod his dad with more things, more artificial means. Mikol wanted to get to the hospital in time to stop them from trying again. So he called, and he did interrupt them as they were about to begin yet another artificial procedure, which would not have done anything to prolong his life or give any greater hope. It would have simply provided them more information about his condition. And he did tell them that my dad doesn't want any more artificial means and I'd like you to stop. And I was very proud of him for being able to stand up.
In looking at my mother, 86 years old, who's in the process of watching her companion of 62 years of being married to my father, frightened, scared, overwhelmed, my sister just being an emotional mess, and looking at the both of them and realizing that I've got to make that decision my father asked me to do. This is the responsibility that he asked me to take. And I've got to choose the time and basically the day when my father will stop living. And that was an intense burden, and there were lots of crying. I was blessed that both my children were there and my wife was there, and that they were there to help me struggle with being able to decide when the time would be right to make that decision. And I was shocked when I told the doctors what I was going to do, that I didn't get any support, I didn't get any assistance, I didn't get, this is the most humane way, in a palliative way, to try to help move your father to the other side, and here's the most humane way to be able to do it. I got no help whatsoever.
You mean the doctors didn't say to you, you're making a good decision here?
They didn't say you're making a good decision. They didn't say you're not making a good decision. What I got is that they were committed to continuing to do what they needed to do to keep my father alive, regardless of the responsibility that I had.
And once you said to them, stop, did they?
No, they didn't. They didn't. And what it took was, and I found that completely shocking, what it took was my talking with the ICU nurses who were monitoring my father, and my having dialogue with the ICU nurses, with my wife in attendance, and talking to the nurses about what is going to be the best way that we can make my father the most comfortable and start decreasing the drugs that they were using to sustain his life. And so it was with the help of the ICU nurses, who I believe really were the angels, that helped me figure out what was the best way to send my father off. It wasn't the doctors.
And so they did eventually stop all of these different medications gradually in a reasoned way. And over time, he simply was allowed to reach the end of his life cycle.
And when he finally did pass, that must have been a dramatic and a relief moment for you all.
It was. I mean, I'd never experienced dialing medications to watch someone's life end. I'd never seen what that was like. What I was told from the ICU nurses was that we chose to stop the medications that he was on, other than what Carolyn said, the respirator and the pain medications, at 3 o'clock in the afternoon. And everyone said, you know, you need to prepare your family within the next three hours. Your father's going to probably be gone. And, you know, my father, being the stubborn person that he was, wasn't ready to go. And in fact, his heart started to compensate when they pulled off a lot of the medications and got stronger. He didn't want to go. And so we started this at 3 o'clock in the afternoon. I figured, you know, everyone else is going to be put out of their misery by the end of the day. We've been doing this and sitting in ICU for days on end. This is the most humane thing to do for everyone in the family, including my father. And my father finally expired around 2 o'clock in the morning. It took that long before it finally happened.